Hello, my name is Dr. Prashant Kumar Nayak. I am the clinical head at Oasis Fertility Hospital, Bhubaneswar. Today we will discuss about male infertility. As you know, that fertility is something that it is contributed 50% by the female partner or the wife and 50% by the male partner or the husband. So always while dealing with a case of infertility, we give equal importance to the male partner and the female partner. If you'll confine to the male partner or male infertility, the first thing we do is we take a detailed history from the male partner. We try to know about whether there is any kind of sexual dysfunction or the patient has any specific complaint related to the fertility. Along with that, if you find any cause or anything related to that, we evaluate that and give a necessary treatment. On the other hand, the first test that we do for a male partner is we do the semen analysis. Usually for doing the semen analysis, we ask them to have an abstinence period of 2 to 7 days at least. And we collect their semen and test in the laboratory. There we find that whether the count of the sperms in the semen sample, the morphology and the motility of the sperms are appropriate or within the normal range. And there are few more parameters what we also assess. If any abnormality, any of the parameters, usually we consider that it is attributing to the infertility. The most commonly abnormality found in the semen parameters is the count, followed by the motility and morphology. When the count is grossly reduced, we call it is oligozoospermia, or when it is the motility is reduced, we call it is asthenozoospermia. When the sperm is completely absent in the semen, we call it is azoospermia. Yes, we do come across many patients are suffering from azoospermia. Azoospermia means there is no sperm in their semen. For them, we evaluate to find out whether there is reduced or absent of production, or there is production of sperm inside the testis but it is not coming out. If it is producing and it is unable to come out through its passes, then this condition is called obstructive azoospermia. And if there is no production of sperm inside the testis, that condition is called non-obstructive azoospermia. In such situations, we do some hormone tests, some physical assessment if required, some ultrasonography. Followed by that, we advise the patients we can go for some surgical procedures like teaser, TZ or micro teaser, in which we can retrieve the sperms from their testes directly and we can assess them in the microscope in the laboratory and we can freeze them. And later on we can use their sperm samples for IVF purpose and they can have their own child. And in some conditions, the obstructive azoospermia is also getting treated by surgical correction of the obstruction. Well, so many times, many patients get benefit by these treatments and sometimes also they get failed. Otherwise, on the other hand, if you'll see there is any problem in their sperm count, morphology or motility, we have a specific treatment. We give medications, we give some lifestyle changes. And after some time, we reassess their parameters of the sperm. And in many cases, we find that it is improved. Well, so this is about the sperm things inside the semen. Otherwise, if they are suffering from any kind of sexual dysfunction, we try to find whether there is some hormonal abnormality, there is some anatomical abnormality or psychological abnormality. So all those things being assessed and given treatment. I am sure that definitely I can assure that if you will meet your doctor and try to find out what can be the causes of your infertility in terms of male partners issues, then definitely we can find out the cause and we can give treatment. Millions of people, many couples getting treatment and having their own child. So also you. So don't delay, please go and meet your nearest doctor and find the solution. Thank you.